In 1918, we were swimming in the dark, as it were.
That year, a new virus emerged, triggering one of the worst pandemics in human history. Often called the Spanish flu, this virus killed at least 50 million people worldwide and reached almost every nation on Earth. About 675,000 people died in the US alone. More soldiers were killed by 1918's flu than died in battle during World War I.
Asian influenza spreads rapidly.
Since 1918, the world has seen 3 flu pandemics. Thankfully, none has been as deadly as the first. There was the 1957 Asian flu, 11 years later, the Hong Kong flu, and most recently, the 2009 swine flu.
There's growing concerns about the dangerous coronavirus from China. The number of cases has gone from a few dozen last week to nearly 300 now, and health officials have confirmed that the virus can spread from person to person.
The Chinese city of Wuhan is under quarantine as the outbreak of the coronavirus worsens. So what that means is bus, train, ferry and other long-distance transportation networks will be suspended.
Every single passenger landing from Wuhan later this morning will be subjected to a screening process by border security and biosecurity officials. They'll also be handed a pamphlet in Mandarin and in English explaining the symptoms of this deadly mystery virus, which presents itself very much like the common cold. Instead, it causes a type of pneumonia that's resistant to antibiotics, similar to the SARS virus. Now, passengers will be encouraged to present themselves to border security officials if they're feeling unwell or if they feel that they could be at risk of the deadly coronavirus.
Well, there is now growing fear that the disease could spread, and several countries are screening transit points for ill passengers. Well, the virus is on the move, and that's what makes it so scary. Hong Kong and Macau have confirmed infections. Other regions have also reported a handful of cases. Thailand, Taiwan, South Korea, and Japan, and also the U.S. Well, the World Health Organization is meeting in Geneva to decide whether to declare a global public health emergency. Well, health authorities have traced the virus now to a seafood market in Wuhan. Well, they're still trying to figure out the exact source and how it is adapting, but they have confirmed human-to-human transmission.
Hey, George, good morning. Yeah, the World Health Organization is holding an emergency meeting tomorrow to talk about this virus as more and more people get sick in Asia. And now we're learning this morning that the number of deaths is also growing.
It's possibly the worst time of the year to try to stop the spread of a virus in China. Hundreds of millions of people are crisscrossing the country this week to celebrate the Lunar New Year with family.
Back in the States, the CDC screening thousands of passengers arriving from Wuhan at JFK, LAX, and SFO. Officials checking temperatures, looking for symptoms similar to the common cold, flu, or even pneumonia as travelers enter the country. At this train station in Hong Kong, passengers getting screened for the virus right off the train.
Beijing's authorities have cancelled New Year celebrations this weekend as a precaution as fears about the spread of a deadly new virus grow. Singapore has just confirmed its first case of the virus. 2 more Chinese cities, meanwhile, have joined Wuhan, where it was first identified, in being put into lockdown.
Since its outbreak in the city of Wuhan, the deadly virus has jumped a number of international borders, prompting large-scale screening measures at airports, bus and railway stations. Containing the virus is an absolute priority, as quickly as possible, because there are fears that the virus could mutate.
The evidence shows that the disease is currently transmitted through the respiratory tract, and there is the possibility of a viral mutation.
We need more information.
If you've got an outbreak, you really try to contain the outbreak. What's really different here is the volume of people, the number of people this is affecting is really, we've never seen anything like that before.
The virus continues to make its way across the globe, with the first 2 cases in Europe confirmed this afternoon in France. And the second case in the United States was also confirmed by the CDC today, a Chicago resident who had traveled back from Wuhan, China early last week. Overall, the CDC says 63 potential cases cases have been or are being investigated in 22 states, with 11 found to be negative. For the 2 confirmed cases here, public health officials are tracking their close contacts and monitoring them for symptoms.
Nepal has come forth and confirmed that one of these cases of deadly viral infections has indeed been reported in Nepal.
Our top story, South Korea has reported its 3rd confirmed case of the Wuhan coronavirus.
There are now at least 5 confirmed cases of the coronavirus in the U.S., states that include Arizona, California, Washington, and Illinois. The French government also held an emergency meeting and now plans to airlift its citizens out of Wuhan back to France. The virus is being reported in over 10 countries. Precautions are being taken around the world. This person escorted off a plane in Baltimore.
Because of this heightened time, we're just using an abundance of caution.
By way of introduction for myself, I'm Dr. Eileen Davila, Medical Officer of Health for the City of Toronto. So as you've just heard from my colleagues, we have the first presumptive case confirmed of this novel coronavirus here in our city.
China's Health Commission is warning the ability of the deadly coronavirus to spread is getting stronger.
The death toll from the deadly coronavirus outbreak has now risen up to 80, and according to the latest that is coming in, at least 2,700 people are said to have been infected so far by this coronavirus.
Let's get right to our top story, the expanding outbreak of the deadly coronavirus. Look at the map. What started in China has now spread to Europe, Australia, and the United States.
The harmfulness of the coronavirus to people of different ages is now changing. And most worryingly, indications the virus is becoming increasingly contagious. Over 1,300 more medics have been flown to the epicenter Wuhan, where officials are scrambling to build 3 new emergency hospitals in a matter of days. These exclusive images, filmed for ABC News from inside the city, show a ghost town, with signs warning people to wear masks fluttering in the wind. Some shoppers take the risk to stock up on desperately needed supplies, but there are still around 1,000 US citizens stranded in the Wuhan area. Now the State Department is scrambling to evacuate some of them, but it appears so far the space to get people out is limited.
Wuhan is in virtual lockdown. In this city of 11 million people, you're not allowed to enter any public space without a mask. All public transport has been closed. The last flights in were already half empty. The final train services were also eerily quiet. Normally the Lunar New Year rush would mean you can't get a ticket.
Here we're at the very epicenter of the virus. Maybe it's best not to travel.
I'm confident that our government has the situation well in hand and that the situation will be quickly brought under control.
Now, wherever you look, people are wearing masks, they're lining up to buy more masks, some people are cancelling their trips, and there is a lot of concern. And what's really made people pay attention to this health problem has been the shutdown of Wuhan.
In all Chinese cities, medical teams are preparing for an influx of patients with the coronavirus, which causes pneumonia. Staff at this Wuhan hospital isolation ward are worried.
We are worried about our work here and get even more worried when we see the news every day. I always say to others it's okay as we are well protected. Actually, I was just saying that to keep them calm. We are actually afraid and worried. But as long as we are here, our own sense of duty will help us to do the job.
We are still all young ourselves, so honestly we feel lost and afraid. Our family members are worried too. But as long as we wear the protective clothing, we'll be okay.
This is how people in Wuhan are responding to the city's lockdown. Turmoil at the supermarkets as shelves go bare, and massive overcrowding in waiting rooms to get screened at the hospital. This woman cries out for a doctor to save her life after finding out she has a fever. Residents are growing more fearful by the day of catching the deadly virus.
A whole city in quarantine. A public health announcement is broadcast to a near-empty street in Wuhan. But the medical centres are overflowing. And even if residents feel well, they could still be a carrier of the new coronavirus. China's health minister told reporters that the virus's ability to spread is getting stronger.
Our knowledge of the new coronavirus is limited. The origin hasn't been found. From our observation, the disease can be spread during the incubation period. The period lasts for 10 days. The shortest is 1 day, the longest is 14 days. This is very different from SARS.
And that means a seemingly healthy person carrying the virus can infect other people before symptoms appear.
The authorities are worried about this going the way of SARS. Now, if you look at the death toll so far, as a percentage, it's not nearly as bad as SARS. But when you consider the raw numbers of people travelling, flights alone, now there are 6 times as many people flying out of China as there were at the time of the SARS outbreak in 2002. And that's why the World Health Organization is set to meet again to decide whether or not to declare this a global emergency.
Coronaviruses are so named because they look like a halo or crown under a microscope. First discovered in the 1930s, they infect the respiratory tract of mammals, including humans. Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS, are also coronaviruses. Some also affect the gut and digestive system. The latest strain, first detected in Wuhan, is thought to be a new one. A common but not unique factor in these viruses is animal to human transmission. Coronaviruses are difficult to replicate in the laboratory, which makes it harder to find cures or vaccines. Like most viruses, they can mutate quickly. That makes them easier to catch and easier to spread. One of the reasons you can catch a cold over and over again. Coronaviruses also spread quicker in winter months and disproportionately affect vulnerable populations with lowered immunity, like the very young and the very old.
This is a very new virus. We've only known about it for a few weeks, meaning it was never detected in a human before. It's going to take time to understand how this particular virus behaves, but in the meanwhile, the toolkit for public health prevention is so much stronger now than it was 2 decades ago. We've learned from SARS, we've learned from various flu outbreaks, and we're seeing that with the prevention measures now, like helping people to make the decision not to travel.
The concern, of course, is that the next pandemic would be both contagious and deadly. That's what has public health officials worried today. If or when a new virus emerges, it will be researchers here at the Centers for Disease Control in Atlanta who will try to spot it and identify it as quickly as possible.
It's not an earthquake or a hurricane with just one geography affected. The whole world is vulnerable.
When a new strain emerges, it's up to Dr. Ann Shukat and her colleagues to help identify the virus, monitor its spread, and help coordinate treatment of the sick. She's the principal deputy director of the CDC.
You don't want to have a plan that assumes things are going like this when your early observations point in another direction. So the better the working relationships are, the more quickly you can adapt, the more nimble the response.
Shukat stresses the importance of early detection. Even 2 weeks can make an immense difference in vaccine development and saving lives.
We know we will have more pandemics of influenza. It's not if, it's when.
You're confident of that?
Absolutely. The probability of a pandemic tomorrow is the same as it was in 2009. So we can't be complacent about our state of preparedness, but we can't assume that the next pandemic will be like the last ones. We have to work through the different scenarios.
We have not given it, I think, all of the attention that it deserves.
Last May, Johns Hopkins University put together an exercise to simulate what could happen in the next flu pandemic.
This news just in.
Congresswoman Susan Brooks of Indiana, who's co-sponsored legislation to bolster the nation's preparedness for public health emergencies, was part of the exercise.
Every time you do an exercise, you realize where the gaps are. If large numbers of people begin to get sick, actually your economy is impacted, our national security can be impacted. There's so many things that people just don't realize.
So how worried should people be here in the U.S.?
Listen, we have to emphasize this is a dynamic and evolving situation. U.S. public health officials are still saying that the risk to the U.S. population is low, but we have to be clear. We don't yet know how this virus spreads. We know it can be passed human to human, but we don't know how, and we don't know how severe it is. We're going to be looking for the mortality rate or the death rate with this.
I'm sure we'll be talking to you a lot more about
Absolutely.
this next coming day.
各位亲友们，各位长辈们，我是金慧，我目前还在武汉汉口这个疫区。我向大家汇报一下，目前我们整个湖北甚至全国的疫情情况。现在已经有9万多人次，这个病毒的传染几率是多少呢？就是一个人传染之后，如果说他没有被有效的隔离的话，或者说进行有效的治疗的话，他会传染给他身边的14个人，那么这个基数就很大了。现在正值春节假期之际，天南地北的亲戚朋友、子女都往家里赶，都是为了阖家团圆，在一起吃一顿团年饭。现在情况特殊，我希望大家不要出门，不要聚会，不要聚餐，春节年年有，只要人平安，大家都可以随时随地的在一起。我现在向大家介绍一下我们整个湖北省医疗物资情况。现在武汉市整个医疗系统及湖北省的整个医疗系统都已经越过了我们的上级卫计委及各个行政部门、市政府、省政府，透过各大媒体在向社会发起物资募捐。这个物资是医疗物资，比如说我现在戴的护目镜，戴的一次性的口罩，戴的一次性的手套，身上穿的这个隔离衣，甚至是隔离裤。这个物资特别精确。我们现在的医护人员凡是从临床下来的，现在全部都又重新上了一线。我现在相当于就是在火线上给大家录这个录像，就是为了让大家引起警觉。我再强调一次，春节放假期间不要出门，就自己在自己屋里待着，要不然我在前方拼命是为了什么？我就是为了让我的娃、我的亲人他们健康，希望大家能够理解。我也知道有些亲戚不在群里面，请看到我这消息的人相互打电话，相互通知，一定要做到。我希望大家能够提高认识，这是一个政治任务。而且报告大家一个很不好的一个消息，这个新型冠状病毒已经发生第2代变异了，也就是说在第1代变异的时候我们可以对症治疗，那么在发生第2代变异的时候，这是要命的。那它的感染几率就不是一个人传染，一个人得上的这种病传染身边14个人，那么它是呈爆发性质的。望大家一定要牢记， 不要出门，不要串门，不要集会，不要聚餐。谢谢大家。